Hello. Welcome, everybody. Rachel, thank you for facilitating this gathering. I love those floating hearts. They're so relaxing to just watch all those beautiful floating hearts. Well, great to see you all again. Thank you for those of you who are coming back after my previous brief Thursday chats. And for those of you who are new, welcome. I'm Leslie Korn, and I'm delighted to have a few minutes to spend with you today to talk about my latest certification in trauma treatment, both PTSD, complex trauma, and we touch on traumatic brain injury as well for those of you working in that field. And I want to share with you, we have had thousands of clinicians in mental health take my certifications in nutrition and integrative medicine and integrative health approaches. And yet, I often get questions from clinicians about, can I do this? What's my role in making nutritional advice or talking about someone's diet or what they're eating or how their belly's feeling? Is this in my scope? Am I able to do this? And what about these integrative approaches, recommending foot baths for relaxation or maybe a little magnesium for sleep at night? And so that's what I thought I'd spend some time with you today and just share a little bit about what I cover in the course. Now, the course is over 30 hours and you receive a certification. And so I'll only be able to touch on just a little bit of the flavor of the course, if you'll pardon the pun. So, Rachel, I am ready for the slides to pop up. And there you go, food in the shape of a heart, because no matter what we eat, our work is also about heartful, compassionate care, particularly when we're talking about trauma and traumatic stress, but of course, with everyone we're working with. So, I want to talk with you about the missing piece in trauma treatment. I will go so far to say that the most important missing link in our mental health work is nutrition. And I guarantee you, if you incorporate nutrition, whether you do it directly, whether you explore the questions, whether you encourage self care, or whether you collaborate with someone in your practice or refer, I guarantee you, you will get much better outcomes. And as a mental health counselor, as a doctor of behavioral medicine, as a approved board supervisor, as a certified nutritionist and herbalist, and as a somatic therapist, you can see I have really explored the integration of all these methods. So I want to answer those questions for you today, or at least begin to, because I do cover it in depth in an hour in a module called Ethics in the course. All right, let's get started. Rachel, next slide, please. And I wanted to share this slide with you, and you'll be able to look at this beyond today in this live presentation, because these are all the methods that I address in the course. And I call this the Brainbow Blueprint. And it originally came out of this idea that if we eat all the colors of the rainbow, it's so good for our brains. So, hence the Brainbow Blueprint. And this really covers all of the different aspects that I teach in all of my three certifications. And so if you look down today, in the lower right-hand side, you will see culinary medicine, digestion, and supplements. We're going to talk today about this whole area, this whole quadrant that we refer to as nutrition, and just get you feeling comfortable in what's your scope, what do you need to consider, and also think this, we are our own laboratories. So no matter what I teach about, what I share about begins with us first. Just like we went through counseling to become counselors or psychotherapists or psychologists, even if we became PTs or nurses, we went through experiences where we explored these methods for ourselves. So, at the very least, we are walking our talk and engaged in self care because we are engaged in a very rigorous, demanding profession, and we have to really protect ourselves against burnout and optimize our health. So, it begins with us, and then we have the opportunity to expand into our client work. Next slide, Rachel, please. Okay, so why do we add nutritional nourishment into trauma recovery care? Now, you notice I said nutritional nourishment because are we not always helping our clients be nourished, nourish themselves emotionally through all of their self care methods? And isn't trauma the quintessential mind body dis ease? Meaning being out of ease with oneself, whether it results from the ACEs, from the adverse childhood events, from complex trauma of the inability to escape interpersonal trauma, whether it comes out of exposure to war, a car accident, an act of nature, as an adult being exposed to interpersonal violence or some other kind of shock. No matter what the cause, one of the effects that we know is it really causes decrements in our ability to take care of ourselves and to really nourish ourselves. And while we're working on all of these aspects of self care, which, as Dr. Herman suggests, and I completely agree, is the first stage of recovery, is stabilizing and engaging in self care, whether it's walking, stabilizing sleep. I include stabilizing nutritional nourishment, really looking at nourishment, particularly when it comes to food or nutrients, herbs, drinks, whatever it is, as an act of self care. And speaking of drinks, is it not true that over 70% of people who are experiencing addictions also have a history of trauma. And so one of the things that we know is that nourishment of the brain and the body, particularly the liver and the kidneys, is so essential in the combo of addictions and trauma recovery. And this is all that I teach in the course. So I ask you to think about, even just consider some of your clients right now who may be struggling. I guarantee you that they're going to benefit from some improvement in what they're doing for their nourishment. So we support all aspects of trauma treatment in our self care process and in our mental health and physical health. And so I ask you, what are you currently observing in your clients? Are they coming in perhaps with a can of Diet Pepsi or Diet Coke? Are they struggling to stop smoking cigarettes? Are they fatigued? What are they explaining? Digestive disorders are highly correlated with the experience of chronic stress and trauma. As a matter of fact, I guarantee you that anyone with PTSD has a digestive disorder, and many people are taking medication for it. The problem is medications do not make it go away. They may help the symptoms, but they don't address the cause. And that's what I want to teach you, is how to help people get to the underlying causes of their distress. For example, did you know that in order to digest food, you have to be in good vagal tone? You have to be in parasympathetic dominance. That's what the body requires. And we teach people how to do mindfulness and mindful eating and meditate or relax or say grace or give a prayer, whatever our method is, yoga. I want to teach you also about how to use nutrition to ease digestion and integrate all of these methods. And you are able to do this. And I'm going to share with you what enables you to do this. But just think about mood, insomnia, autoimmune, cravings, the polypharmacy. I often work with people who are taking 6 or 7 or 8 medications, who want to reduce them, who've got side effects from them, who are often taking one medication to reduce the side effects of the original medication. People are fatigued, they're in pain. We know there's a high correlation between pain and the experience of trauma, and we've got lots of ways nutritionally to deal with this. And so, in general, I don't know about you, but I'm getting a lot of clients these days who are being told they need to take medication, psychotropics, SSRIs, and they don't want to. They've heard about the side effects, they've heard about the weight gain or the suppression of libido, and they say, what are my alternatives? So I want to be able to give them information about those alternatives while we're collaborating with their prescriber. Next slide, Rachel, please. So, what do we look for and how do we start the conversation? And one of the ways I start the conversation is by doing an intake that asks for not just emotional well being, but physical well being. And I want to hear complaints. I want to hear about pain issues. I want to hear about digestion. I want to hear about what kinds of medications people are taking. Doesn't mean I'm going to act on it right away, but I want to get the full scope because I want to offer mind and body support and even spirit support if people are interested in that. And so I can often begin with my intake by asking some questions. We know, for example, with children, children commonly complain of stomach aches when they're under stress. And they may also, along with the stress related stomach ache, they may be allergic to milk products. They may be allergic to different grains, or they may have had lots of ear infections and had lots of antibiotics as children earlier in their life, and then their microbiome, their probiotic levels, their good bacteria have been depleted, and no one has been able to educate the mother or the father or the caregiver about this. And so we can be aware of how the interaction of nutrition and stress plays a role. Start asking these questions. I might even begin with what I call the food mood diary, where I ask someone to begin paying attention to how is it you feel after you eat Cheerios in the morning with a Diet Pepsi? Or how is it you feel when you have 3 cups of coffee and a donut? How do you feel by 10 a.m.? Oftentimes, my clients who are very mood labile discover that they're not nourishing their brain with good food. They're not nourishing with good fats and good proteins. And so I want to begin that dialogue around self care. I want to begin a dialogue around, hey, are you cooking for yourself? Are you preparing foods for yourself? What kind of foods do you love? And I love this discussion with my clients who are from a variety of ethnic backgrounds or even from backgrounds where they're not quite sure about counseling, not quite sure about talk therapy. There's still a little bit of a stigma about mental health, but I guarantee you, people love to talk about their food, their diets, their herbs that they love to take, and particularly people that come have migrated or refugees or even first, second, third generation, who doesn't love to talk about how they're taking care of themselves and what they're doing in the kitchen or what they may not be. So, all of that is part of the big bowl that gets filled up with looking at where do we begin with clients to talk about. And I want to say to you, yes, you can do this. And I want to share with you just a few uh, paragraphs from each. Well, I haven't chosen every profession, but at least a sample from the mental health profession. Oh, and before we leave this slide, Rachel, look to the left. I bet you're wondering what the SAD diet is. It's the diet that makes us sad, and it stands for the Standard American Diet, the SAD diet, because this is the diet that dysregulates our mood and doesn't give our brain, mind, and body the nourishment it needs. And trauma, if anything, depletes the body, it depletes the strength, it depletes the adrenal glands, it causes tremendous fatigue and tremendous depletion of nutrients. So we're in a good position to support the missing piece with our clients by doing nutrition. So at the bottom of this slide, I ask, can I do this? Meaning as a mental health provider, or perhaps even another provider who's not trained in nutrition. And I say, absolutely, you can. So let me share with you a couple of the statements from either our codes of ethics or some recent Association Journal articles. Next slide, Rachel. This is from a marriage and family therapist, and I hope we've got some MFTs with us today. And this is a link, it's actually a link to an article I just published in the Journal of Marriage and Family Therapy with a student who actually took the certification course. And I was very honored that he invited me to co-author this article about why marriage and family therapists need to know about nutrition and can help their clients. And I love working with families, and it's ideal for doing nutritional and mental health change together. Next slide. And social work. Social workers, and here's a wonderful article on social work about how we haven't traditionally taken an active role in the direct discussion of nutrition with clients, but we need to. And this is a recent article, and I've given you the references for this as well. Can you all hear my little 17-week-old puppy in the background? I think he's playing. He's also teething, those of you who've had 17-week-old puppies. Next slide, please. And in psychology, psychology has traditionally been the last to embrace nutrition, but look at this article in an APA organization article. Psychologists are a crucial part of the interdisciplinary effort to improve diet quality. And I've trained both in the trauma course and the mental health certification hundreds of psychologists who are now doing mental health nutrition. So I hope we've got some psychologists with us today. It's the new field is called nutritional psychology. Next one, please. And then counselors. I've actually taken this out of our code, and I'm very proud to be a licensed mental health counselor. Taking this out of our code and look at, we have a command we have written in our code of ethics to address wellness. And what does wellness address? Wellness also includes nutrition, along with exercise, sense of humor. And I hope you'll engage in laughter yoga with me in this certification as well. So we cover all of these 12 spokes of the wheel of wellness as well. All right. So you're asking, but I don't know a lot about nutrition. Well, good. Then you are ready to study with me and take this course. I've got a textbook on nutritional therapy written for counselors and mental health psychologists, along with nurses, anybody who is not yet trained in nutrition, to understand how we can begin this dialogue. And the analogy that I use is that we study psychopharm as well. It doesn't mean we're going to be prescribing an SSRI or an antipsychotic, but we need to know about it to help our clients. But we can go even further. Not that we're going to prescribe diets, we're not going to do that, but we're going to educate, we're going to engage in psychoeducation. So here's the one thing to keep in mind. Whether you can actually engage in nutrition and psychoed for nutrition is generally based on where you live. Most of the states in the United States allow anybody to give nutritional advice. And what I say in my training and in my book is that's fine. Anyone can give nutritional advice. Now, are you competent to do it? And that's the real key. There are a few states in the United States, and you can look up where that is in your state, and I can give you the link to that. I think if I didn't give it this time, I can give it to you in the next week when I'm coming back to talk a little bit more. Then I will give you that link to that map. But there are a handful of states in the United States where only registered dietitians or certified nutritionists can give nutritional advice. And that's fast changing. As a matter of fact, last year in North Carolina, that was the case. And because so many mental health and non nutritional providers requested and really lobbied for this change, now people of any persuasion can give nutritional advice. My emphasis is on be competent to do it. And we don't need a nutritional degree to suggest to a client that drinking 4 or 5 cups of coffee a day is perhaps exacerbating their anxiety. So I walk you through nutritional therapy for mental health, particularly nutritional therapy for complex trauma and PTSD, along with TBI. There's some tremendous insights into enhancing all of these three intersecting forms of distress. And we do want to de stress with nutrition and a whole range of integrative approaches. It's not just nutrition, it's the use of herbs. And by the way, anybody can recommend an herb in the United States. It is not governed at all by any governing body. But again, you want to know what you're doing. And I teach you how to do that. Um, I go through specific yoga exercises for PTSD and complex trauma and for TBI, mindfulness, laughter yoga, integrative assessment, really throughout that whole Brainbow Blueprint to really help you, not just you and us for our own self care, for our own families, for our friends, but also to improve the outcomes with our clients. Rachel, I think next slide. Let's see what we've got. Oh, I'd forgotten the addictions counselors, of course. And there's a great amount of work being done on addiction therapies. In fact, I work with a number of my former students who are addictions counselors who are delivering care post rehab. And it's an ideal niche to develop if this is an interest of yours. Next slide. Oh, well, here we come to some resources. I've given you a list of my books here, and you can certainly find them on my website. The one that I spoke about, the textbook, is Nutrition Essentials for Mental Health. And Rhythms of Recovery in this pile here is the one specifically for trauma. But you can look at them, and I've got lots of free resources, excerpts from them, recipes as well. We're doing a certification, as you know, in post trauma therapy using integrative approaches and nutrition. And I do mentoring. After you complete a certification, you're eligible to participate in a monthly live clinical supervision group. And we've got several of them going now with graduates. And final slide, I think, is our goodbye slide, and thank you. But I'm going to now take some questions because I think we have seen some coming in. All right, let's see. I'd love the link. Very good. Are there any questions, actually? I'm curious about how to protect against the toxicity of diet culture and fat phobia, having these discussions. Absolutely. I've got a section where I address avoiding shaming behavior and shaming language. And I think we're not talking about weight loss, we're not talking about weight gain, we're not talking about body shape. We're talking about awareness about how do I feel? How do I feel when I eat these foods? And how do I feel when I eat other kinds of foods? What's working for me and what isn't? And that's really the focus of this work. And I go into that quite a bit more in the group. and in the class. But I think it's very important that this isn't about one ideology. This isn't about this any one right diet because there isn't. Everybody has particular needs, and if there's one thing that trauma does, is it often takes away the access to what do I need and answering that. So much of what we do in mental health anyway is helping people identify what do I need for myself and how do I get it. This is just the next step in integrating how do I want to nourish myself, what's working for me and what isn't. So thanks for that great question. Thank you. All right. I see a private chat. We've got this question as well as one more. Thank you. I can the question though, the private chat is blocking. Can we get rid of that private chat? Let's see. There we go. From your experience, how long does it take for mood to begin to change after making dietary changes? I love that question. Do you know that when I work with people who are addicted to sugar, that after 1 week, if they cold turkey sugar and eat a high protein, high fat diet, they will already feel more mood stable. It's pretty incredible. Now, that said, we don't often live our lives eating just protein and just vegetables and fruits and fats. But that's a particular let's detox from that sugar craving. And the best way to detox from a sugar craving, which, as we know, is very disruptive to mood, it's not just disruptive to mood in trauma. It increases anxiety, it increases inflammatory process, which exacerbates depression, it exacerbates focus and attentional issues. So that's often where I begin with people, is just reducing sugar, noticing how you feel with it or without it. And then when people are ready for a 7-day detox, they go on to as much protein, as much fat. Now, good quality proteins, good quality fats, no margarine, but they can have butter and olive oil and sesame oil, really good quality cold processed fats, good quality plant and animal proteins, lots of veggies, lots of fruits. And after 7 days, I guarantee you, your mood feels 90% more stable. As a matter of fact, one of the things I talk about in my other training in the mental health, nutrition, focus training and certification is that that's an ideal way to really identify what is intrinsic bipolar disorder and what is perhaps some bipolar or disruption of circadian rhythm, along with sugar as it's exacerbating mood. We don't really know about mood lability until we incorporate an analysis of how diet, like sugars, like white flours, even what we call excitotoxins, these things like aspartame, we know scientifically disrupt mood lability. So even when people are coming off sugar and they go to artificial sugars, it's often no better. So I want to give people support and hints and tips. So in general, you can feel better in 1 week. However, as I say, you don't stay on that approach forever, but you can begin to become aware of, wow, I didn't realize this was affecting me so. And then you begin to stabilize not only your mood, but you begin to make choices that really work for your mood. And so you might see results in a week, in a month, in 3 months. It's kind of like asking, how soon after beginning psychotherapy or counseling or EMDR do you notice results? Well, you can notice results pretty quickly, and then we build on them and stabilize them and enhance them and increase them. And we really are in self-care our whole lives of improving our health and kind of staving off the effects of stress in the environment. All right, let's see if we've got any other questions. All right. One final question, I think. Did you say there was a final question? Maybe I misunderstood. Oh, I guess that was it. Well, that's great. Come next week, I'm going to talk about now some actual interventions that you could feel very safe to incorporate with your clients. And you can also take a look at the outline for the training and the certification if that interests you. Thanks, everybody. Keep breathing.